And sometimes this releasing helps the shoulder. So I have Rachel here today. What do you want to work on?
Definitely like pain in my shoulders or tension there, and my left hip. All sorts of junk going on in there.
What do you do? Like, is it hurt when you move it, or is it?
Most of the time, the pain is just walking, like right in here, and then it's really tight in the low back on the left side, into the
all in the left.
Yeah.
All right. So I'm going to have you start face down. You're going to put your nose right about here, and you're going to scoot down towards me. And let's just experiment with the right side first. Okay. So lift the right thigh off the table and then put it down. And then lift the left thigh off the table and put it down. Do you feel any difference in the hip just lifting the leg?
I mean, the left one hurts.
It hurts. So when you lift the left leg, point to the hurt spot.
It's like in here and like almost into my inner thigh as well. Okay. Along with the outside.
So come up like 2 more inches higher on the table, right about there. I just want to check the alignment. I think there's something really off in your pelvis and your hip socket. So let's see if I can do a little different. Maybe improve the joint position. Did you just give me thumbs up? I saw some thumbs up, some thumbs flying. Yeah, so you have what's called a PI ilium on the left, and that means that when posterior and inferior, it's creating a weakness on the left side, and then that throws everything else out of balance. So I'm looking for your ischial tuberosity, and that's the sits bone. That's what yoga teachers call the sits bone. You're a Pilates instructor. I'm sure you've heard that word before. And I'm just adjusting. First one was ischial tuberosity. Second one was the sacrotuberous ligament from the sacrum to the ischial tuberosity. And then the third one here is the fossa of the ilium, or the concavity of the ilium, where I can get a really good set point. But already I have it even. So I'm already moving that PI ilium back to a normal position. Now I'm going to rotate the hip, and we see the legs go short again. Went short by about a good 1/2 inch to 3/4 of an inch. Lift this pelvis off the table a little bit. And I'm going to come in and work the inside of the femoral head where it meets the hip acetabulum. Now we're going to check internal rotation again. It's holding. Now I'm going to fan your leg out like this so you're off your kneecap and pull the whole knee. Did you feel the ankle went too? But did you feel the whole, I didn't mean the knee, the whole hip pulled out?
Yeah, definitely.
So I got the hip and accidentally the ankle pulled out at the same time. So now let's roll it again and see. All right, now lift this leg. Tell me what it feels like.
Oh, much better.
Much better. Would you say 20% better or even more? Try it again.
Yeah. Yeah, I would say now the pain is mostly just like a little bit out here.
On the outside. Okay, that's fine. That's more muscular. Bend this knee. Scoot your hip out into almost like a dancer's passe. I'm going to dig in now, and this is not going to be fun because I'm going to hit you hard with the elbow into the trigger point. Now, so straighten that leg out and put the ankles together. So go ahead and put those ankles together. Good. And now bring that leg up again. Good. And put the ankles together again. Straighten them out. And bring the leg up again. And follow with the camera what she's doing with her leg. There we go. And follow the leg. Follow just the foot. And do one more. And then come back to my elbow. Good. And now stretch it straight and lift this leg up without me helping you.
Oh, yeah.
That's it, right?
Yeah.
We're close. I know how to fix that. That would probably take a couple of visits because your hip, I think, has been wonky for a while, right?
Definitely.
How long? Like months?
I mean,
a couple of months?
It's been an issue. It's gotten really bad in the last like 3 or 4 months, but it's been kind of an issue for like 2 years.
2 years, okay. So it would probably take a month or two to really fix it if you're ever determined to fix it. And you'd have to come in and do a few visits. You'd have to get on my table and let me work on you a few times. Okay. But not a lot. I bet I could do it in like 6 visits. Okay. But I showed you enough today so you could see when you get up, it'll feel pretty good. Lie on your side facing me. That should have felt good.
Yeah.
Move closer to the side here. Let me hold your wrist and get you off your shoulder a little bit. I'm gonna pull your hip towards me. Got it. Come the other side. Bring your pillow with you. Pull up the top knee. Let me pull this shoulder out. Pull this down towards me. Good. Roll on your back. Scoot to the top of the table. You said this is the clicky shoulder sometimes, right? Just going to push that head of the humerus straight back. Then I'm going to come to the distal clavicle, proximal clavicle. Got it. So I'm also going to feel like this condyle at the occiput feels a little jammed. And sometimes this releasing helps the shoulder. Come stand now and feel how you feel. Move around a little bit. Test that shoulder again. See if the shoulder's less clicky.
Yeah. Just standing here feels less clicky. Oh, yeah.
Should be better, right?
Yeah, a lot better.
All right. How's the hip feel?
Does a lot, like, yeah, it doesn't feel like there's, like, tension.
I got it centered. So what I did was your pelvis was off, and I just straightened it.
Definitely.
And here's a picture of it. See there? I'll bring it to you. So your pelvis was doing exactly like this picture. So it was sinking on the left, and I pushed up on the sits bone and kind of leveled that. Okay. And immediately you'll feel like you're on level ground rather than like tilting over. So that's, good to do.
Yeah, definitely.
And it probably needs a few times of repetition to create that muscle memory. Awesome. But when you do, you'll really own it again. You'll be like, it'll be back where it belongs.
Yeah, it feels a lot better.
So thank you.
Awesome.
Appreciate
Thank you so much.